So within this bootcamp, I try to build up a set of solid understanding, not only about agent-based modeling in general, but also about undertaking tasks in this particular software, which is engaged in commonly by many, but not all attendees. And as part of that, I seek to build up a variety of agent-based models. We have here some interested in communicable disease, and we have a need to explore several additional basic mechanisms of agent-based models. We saw networks yesterday, and how they could be used in characterizing peer effects. But today we're going to be exploring networks further, and particularly looking at ways in which another way in which individuals can influence one another over networks, one that's even more common, namely the use of messages. And we'll be seeing in the process of how we can build up a model, how we can put in place regular reporting processes, seeing ways of summarizing information with additional analytics like histograms, and ways in which those can be used to illuminate some aspects associated with networks. Okay, so in order to do this, we're going to dive into some of the modeling tools that we've been using. So I'm going to go share my screen here, and we're going to be covering a lot of material in this network area. I will post a set of slides here that talk more conceptually about networks and agent-based modeling, the roles that they play within this sort of modeling, capturing different sorts of structures between individual people, between organizations and individuals and organizations, between healthcare practitioners and patients or with each other, and which also goes over more systematically some of the motivations for representing networks. And as you can see, there's many of them here that you'll find prominent within the literature. Motivations for capturing network structures as ways of capturing localized perception, as ways, for example, those in my family might exert disproportionate impact to my caregiving or testing or vaccination decisions. The experience of my family and health area might shape my own behaviors and risk tolerance. Representing disparities in access to resources, capturing dynamics, fact that say people with low vaccination, people who have greater resistance to vaccination may cluster together within networks, be linked up to one another socially or in family networks or in communities, to capture effects across networks, which is say contagion that really has distinctive features, where sometimes it spreads and sometimes it just fizzles out, or it takes a while to go to propagate around the network until it explodes. And capturing the spread from person to person or person to organization of innovation, beliefs, knowledge, attitudes, pathogens, etc., rumors, information. And networks also have an impact and have a key role to play in representing certain types of interventions. And there's an interesting but broad set of health interventions that are based around networks. Right? We use networks foundationally in the contact tracing process that forms such a key element in communicable disease control. there's since the 80s, there's long been recognition of the need to focus on network cores and prevention. The fact that certain STIs that might otherwise go extinct in the broader population might live in a persistent way within a network core of individuals with high levels of sexual contact with commercial sex workers, etc. And in understanding the spread between communities and intercepting that spread, there's a need to think about networks. If you're engaged in network building or altering, these include some things as basic as support groups, right? Support groups for people trying to stay sober, for substance use, support groups for those dealing with caregivers of those with dementia, groups that exist to support individuals with mental health challenges. A lot of these derive their effectiveness, even walking groups, right? Derive effectiveness through network innovation by linking people up to form a walking group. It's one of these smaller group of CDC recognized evidence-based interventions that can improve physical activity. So network building, fostering connections between people is quite foundational in our pursuit of health interventions. And there are innovations that we undertake to help limit the impact or to lessen any risk of damages caused by networks. Innovations like the Child Safe program run by colleagues in Australia for teen social network engagement with social network environments, or needle exchanges to help lower the spread of infection across networks. A final reason that I've listed here that we often represent networks is to understand what phenomena are kind of occurring at the core versus the periphery in terms of the data we're collecting from the world and relating it to what's going on in the model. So I have some slides here, and I will provide them via the lecture slides area, but I want to go through these interactively by building up a network model. And we're going to do this from the ground up, so you get some experience building models from the get-go. You can find these slides as soon as I post them. Can't remember if I've already posted them, but I will post them here to our lecture slides area. And I think I'll do that right now if there's anyone who wants to work with them. Here we go. And I'll put them in lecture slides. Yes, they are here. Okay, networks and ABM modeling. Great. Okay, so with that having been said, I want to stop this screen and or stop the recording, and we will get started.